Hello, I'm going to be presenting an overview on spinal or midazolam, and I hope you enjoy it. Spinal midazolam is a medication that is used to manage certain medical conditions. It is part of a class drugs called benzodiazepine, which acts on the nervous system to reduce anxiety and promote relaxation. This presentation will provide an overview of spinal midazolam, including its definition, mechanism of action, indication, contraindication, precautions, administration, and the results of clinical trials. Spinal midazolam is an important medication for managing certain medical conditions, and healthcare professionals need to be familiar with its property and potential risk. Spinal midazolam is a medication that is used to manage certain medical conditions such as muscle spasm, seizures, and chronic pain. It is administered directly to the spinal cord through an intrathecal or epidural injection. Midazolam, injected spinally or epidurally, enhances the activity of a neurotransmitter called GABA aminobutyric acid, or GABA, in the brain and spinal cord. This leads to a reduction in anxiety, muscle spasm, and pain, and promotes relaxation. It is a benzodiazepine that is widely used in sedation, anesthesia, and management of seizure. It is short-acting and it is metabolized in the liver and excreted by the urine. It is used to manage several medical conditions, including muscular spasms, seizures, chronic pain, and anxiety, like I mentioned before. And it is particularly useful in patients who are not responding to other treatments, who are unable to tolerate the side effects of other medication. Multiple sclerosis, spinal cord injury, and cancer are among some of the indications for the use of spinal midazolam. Spinal midazolam can also be used in palliative care settings to manage pain and other symptoms. The dose and administration method of spinal midazolam will depend on patient's age, weight, medical condition, and other factors. So the healthcare professional should follow established protocols and guidelines for administration of this medication. What are the contraindications? The contraindications for spinal midazolam are, of course, allergy to benzodiazepine, and patients who are allergic to benzodiazepine should not receive spinal midazolam. Although I have never seen yet an allergic reaction to midazolam in any form, it is good to take this into account. And of course, in certain patient populations, such as the elderly and those with liver or kidney disease, one should be very careful with the use of midazolam. Spinal midazolam can be more potent and have a longer duration of action in these patients, so caution should be exercised when administering the drug. Next, I will explain the potential risk and side effects of using spinal midazolam. Before this, I should mention that we have done about 100 cases in several different forms and several different dosages. Among the most common is canal stenosis of the back, but also in C-sections and other type of pain, chronic pain and pain syndromes. And the thing we like most about spinal midazolam is there is very little important side effects. Almost never is there a drop in blood pressure. Almost never is there vomiting, and because of the drop in blood pressure. We do see some of the patients, of course, get relaxed and not really, maybe not even a deep state of drowsiness, but you can, if you leave them alone, they'll fall asleep, and if you talk to them, they're awake. So we have to take this into account because it can cause drowsiness, dizziness, confusion, and respiratory depression. Patients should be carefully monitored for these side effects, and healthcare professionals should be prepared to intervene if necessary. Intrathecal or epidural injection are the most frequent methods to achieve what we're talking about this lecture. The administration method will depend, of course, on the patient's medical condition and other factors and the preference of the healthcare professional. But the most common application method is intrathecal. Spinal midazolam is typically administered by a trained healthcare professional using sterile technique, and basically any anesthesiologist that does spinal or epidural anesthesia can use this medication. Patient should always, like any other technique, be carefully monitored for reactions such as respiratory depression. Although, again, anecdotally, we have never seen clinical respiratory depression. It should be stored in a cool, dry place from light and heat, and according to the protocols of your institution. Clinical trials have been shown that spinal midazolam can effectively manage muscle spasm, seizures, or chronic pain. It can also be used in palliative care to manage pain and other symptoms. Some limitations of the studies include that there are small samples and use different dosages and administration methods. Future research should investigate the optimal dosage and administration method for spinal midazolam and its long-term effect on patient outcome. Emphasis must be placed on the importance to do further studies and validate the use of midazolam, and there's an opportunity to learn from this and to uh, continue with education on this topic. So, a long story short, spinal midazolam is a medication used to manage certain medical conditions such as muscle spasm, seizures, and chronic pain. It works by enhancing the activity of GABA in the brain and spinal cord. Healthcare professionals should be familiar with its proper use and potential risk. Um, Topics may include establishment that needs to be worked on our protocols and guidelines, and of course, patients should, like mentioned before, should always be monitored, like any other procedure. And um, I would like to call to action and encourage healthcare professionals to continue seeking opportunities for continuing education and to share their knowledge and experience with others in the field. There's extensive uh, research sources and citations, and here I'm showing a couple. You can read that on your own. And I hope you have enjoyed this talk, and we welcome any criticism or advice you may have, and hope to hear from you soon.